You're ready. You guys good to go? Alright. Let's do a brief overview of the round thus far. Now, our opponents themselves said when they opened up our case that we need to work together to find solutions to the problems we face as a country. And it is our contention as the pro side that the small healthcare reforms that our opponents propose simply would not be enough to fix the to achieve the radical change that we need as a country to fix our healthcare problems. What they say is that France does offer a lot of benefits, but they say there are small things about it that means that we shouldn't copy everything they have. And that is true. Not everything in France can be translated to the United States, but the model itself can. And that's why we need to vote pro in today's round, because the model itself is good. And that's what we can look at as the basis for today's round. And with that in mind, we can look on our opponent's first contention, which they say revolves around the citizens that don't have health insurance. However, we need to look at the fundamental problem with this argument. The people that don't have health insurance in France aren't citizens at all. Instead, as our opponents themselves say, are illegal aliens who aren't afforded any of the rights of French citizens to begin with. What this means is that we would be basing a con ballot off of not giving health insurance to illegal aliens who aren't really afforded the rights of citizens to begin with. In France, if you have a medical emergency, you are still admitted to a hospital. You are still admitted to these free clinics that would still exist, because I guarantee you, France's system does not eliminate charity. But at the same time, we need to focus on the key aspects of the French healthcare system and see this small subsidiary harm really doesn't weigh enough to be worthy of a con ballot. With that in mind, we can look at our opponent's second argument, which says that the government will decide who can and cannot receive medical aid. Well, we need to really take a closer look at the French system. And it really is a system of choice. You choose your doctor. You choose your health plan for the most part. And the government is simply an insurance company. It's simply another aspect of the insurance fold, which not only increases competition, but just allows for another option for where you can buy your health insurance from or get your health insurance from at a lower cost than you would be able to in the United States. What this means is that the government is not going to be rationing out medicine or rationing out health insurance, but instead you're going to have access to, at an affordable price, the best healthcare system in the entire world. Because as the World Health Organization is rated year after year again, France is #1. Contrast with the United States, what scores at a puny 37. What this means is that from clear empirical studies, the French healthcare system is far more effective at treating its patients and allowing patients to have good access to healthcare. But additionally, our opponents thirdly contend that doctor education, malpractice problems make all the transition impossible to the French system. However, let's look at the doctor education. Now, it will take some money to lure doctors into the field. But all this does is, as the system in France allows for, is it allows more doctors to get into the medical field. Because right now, medical bills medical school bills are so expensive and so prohibitively expensive that it really discourages a lot of people from getting into the medical field, really discourages them from pursuing a medical career. However, in France, where they have 3 times the amount of doctors, and this is largely attributed to the fact that medical school is free. When we have this free medical school, it will cost taxpayers some money, but the long-term benefits far outweigh the small cost. So with that in mind, we can look at the malpractice issue that our opponents bring up, but we need to look at the problems with the United States tort system and see that it is clearly the most convoluted and one of the worst tort systems in the entire world. The French system is far more streamlined, far more suitable for and less intervention by lawyers. It allows citizens to really bring complaints that they have legitimate complaints and allows them to get them resolved. With that in mind, let's look at our opponent's first benefit of not implementing the French healthcare system. They said that innovation will continue to increase. However, they have this correlation, but there's no causation. The reason we have all this innovation is because we have the biggest economy and we have private insurance, which still exists in the French system. So we're not taking away that benefit. And they say Medicaid is efficient and it works to serve the poor people. However, time after time again, Medicaid is failed when people need it most. And for all these reasons, we ask for a pro ballot.